Tomorrow morning, before you eat or drink anything, walk to the mirror and stick out your tongue. What you see in those first few seconds could be your body sending you a warning, one most people completely ignore, because your tongue isn't just for tasting food. For centuries, doctors have called it a mirror of your internal health, and the morning, before coffee, before brushing, is the one honest moment to read it. So let's go through what a healthy tongue looks like, and the 5 warning signs that mean it's time to see a doctor. Section 1. The baseline. First, what's normal? A healthy tongue is pink, moist, with a thin, faint whitish film across the surface, and tiny bumps called papillae that help you taste and grip your food. Here's the key word: thin. A light coating in the morning is completely normal. It's just bacteria, dead cells, and food debris that settled overnight. Brush it, drink some water, and it fades. The problem isn't a little coating. The problem is when the color, the thickness, or the texture changes and stays changed. That's your body talking. So here are the signs worth listening to. Sign number 1, a thick, clumpy white layer that doesn't brush off. A thin film is harmless, but a heavy white coating that stays put or leaves raw, red patches when you scrape it, can point to something more. It may be oral thrush, a fungal overgrowth common in people with diabetes, those on antibiotics, or anyone with a weakened immune system. It can also signal dehydration, or in some cases a condition called leukoplakia, white patches linked to smoking that rarely can turn dangerous. The rule of thumb: if a thick white coating lasts more than 1 to 2 weeks, or comes with soreness or burning, get it checked. Sign 2, a smooth, glossy, slick surface. Sign number 2 is the opposite problem. Instead of too much coating, there's none at all. If your tongue looks smooth, shiny, almost polished, and the little bumps seem to have vanished, that's a real red flag. A smooth, glossy tongue often points to a nutritional deficiency: iron, folate, or vitamin B12. When you're low on B12, the tongue can lose its papillae and turn smooth and tender. This is sometimes the first visible clue of pernicious anemia, an autoimmune condition where your body can't absorb B12 properly. So if your tongue feels slick and looks like glass, especially with fatigue, that's worth a conversation with your doctor. Sign number 3. A tongue that's turned bright or deep red, not its usual soft pink. A red, swollen tongue can signal a vitamin B or folic acid deficiency, or inflammation called glossitis. In pernicious anemia, doctors describe it as a beefy red look, but there are sharper warnings here too. A bright red tongue with a sore throat and fever can be scarlet fever. And in young children, a red, swollen tongue with a rash and lasting fever can point to Kawasaki disease, a serious condition that needs immediate care. Red that doesn't fade isn't something to brush off. Sign 4, a purple or bluish tint. Sign number 4 is one of the most overlooked and was of the most important. If your tongue takes on a purple or bluish tint, pay attention. Purple can signal poor circulation or an underlying heart condition. A bluish color may mean your blood isn't carrying enough oxygen, which can trace back to lung or, in some cases, kidney problems. This isn't a cosmetic issue. A tongue that looks blue or purple, especially with shortness of breath, is a reason to seek care promptly, not wait it out. Sign number 5, a yellow coating that won't go away. Most of the time, yellow is harmless. Bacteria buildup, dry mouth, or smoking. Cleaning your tongue and hydrating usually clears it. But when yellow persists despite good hygiene, it can occasionally point to digestive issues or problems with the liver or gallbladder. And in rarer cases, a yellow tinge can be an early sign of jaundice. A day of yellow? Normal. Weeks of it, get it looked at. So here's your takeaway. Tomorrow morning, take 5 seconds at the mirror. Look for the thick white that won't wipe off, the smooth and glossy, the deep red, the purple or blue, and the lingering yellow. Your tongue is one of the easiest places on your body to spot an early warning. If you know what you're looking for, none of this replaces a doctor's visit, but noticing the change is the first step to catching the cause. If this helped you, subscribe to the Body Test, where we help you read the signals your body is already sending.